viewers. This speaking test is brought to you by Emmet Academia. Since this is a mock test, we won't be requiring any ID. You will be having 3 minutes for preparation. Your 3 minutes starts now.
Hi. Good morning. I am Emmet, one of your attending nurse for today. Well, Michael, let me confirm you. I am here to give you information regarding your discharge process and aftercare. Could you please tell me how are you feeling after the surgery?
Nurse, I am a bit concerned about my condition because my leg is still quite swollen.
Yes, Michael, I can understand your concern, but let me reassure you that your swelling is not unusual. However, it will reduce with the help of elevating your hip, as well as with an exercise regime. Additionally, I would like to give you information about your wound, Michael. It's good news that your wound is healing well. Secondly, there is no infection. Besides, the dressing and clips will be removed in 2 weeks. Are you following me, Michael? Anything else which worries you?
Yes, nurse. I think I should go and see my GP.
Michael, I can sense your fear, but let me explain to you when you have to contact your GP, that is if you have any signs of infection, such as redness, secondly, increased swelling. Moreover, if there is any leakage from your wound. Furthermore, you have to self-administer the injection delteparin 4 up to 10 days after surgery once daily. Am I clear to you, Michael?
Yes, nurse. But nurse, I am worried about self-administering the injection. Even though I had injections before surgery, the nurse helped me to administer them. I would like the nurse to show me how to administer the injection before my discharge.
Oh, Michael, I can understand your concern, but let me reassure you it's not a difficult task. But don't worry, the nurse will show you how to administer the injection. Is that okay, Michael?
Yes, nurse.
Anything else you want to clarify, Michael?
Nurse, my doctor had told me that I can't start driving or go back to work yet, but I am hoping I will be able to do these things soon.
I can understand your situation, Michael, but would like to advise you to follow your doctor's instructions. Your follow-up appointment will be usually 6 weeks after the surgery, so you're not allowed to drive or go to work. I hope, Michael, you will follow all the instructions given. Michael, could you please tell me, did you arrange for someone to pick you up from the hospital and to assist you at home after your discharge?
Yes, nurse. My son will pick me up from the hospital and will stay with me for a few days. Moreover, I have arranged a person who will assist me after my son leaves.
Good to hear that, Michael. Once again, I would like you to confirm all arrangements. Michael, am I clear to you?
Yes, nurse.
Do you have any concerns?
No, nurse, I'm happy to go back home.
Good to hear that. I hope I have cleared all your concerns. I wish you a speedy recovery, Michael. Thank you.
This is the end of the speaking test. Thank you for watching.